first question is from Miss Angie C. Her question is what causes kidney stones and is there a way to prevent them?
Okay, very good. Yeah, so kidney stones have many things may cause kidney stones. It is definitely genetic, so it's something that we can see may run in families. Diet is very often involved, and there's people who just have the predisposition to form them, even if their families didn't have it themselves. So the thing with kidney stones is we know one thing that prevents is trying to drink as much water as possible. But even some patients do this and they still form stones. So the main thing when somebody has a kidney stone, and especially if they have it not just once, it's a second time, a third time, is to make sure they get a study of the kidney stone so we can see exactly what kind of kidney stone it is. For example, if there's one type of kidney stones, you have to limit the amount of calcium that you eat. Another one, you have to decrease the amount of oxalate that you eat. So based on if we do the study of the stone and we know what the stone is from, then we can make diet recommendations or medication recommendations. So as far as the cause, you have to have the genetic predisposition plus a diet that makes your body make more of this substance to form the stones.
Perfect. Okay, so now we got two questions. Actually, I labeled them from Cassandra because she asked one, and I think the clarity of the first question is actually more important. The first part is, what is a GFR?
Okay, so GFR stands for glomerular filtration rate. So this is the way that we have to measure somebody's kidney function. And that's why we encourage all of our patients to always come and do their lab, because that's the only way we can know if somebody has any kind of derangement, alteration into their kidney function. Remember that you don't get symptoms from a decrease in your kidney function until you get to less than 40 or 30%. So you can be 50% less than what your kidney should work, and you have absolutely no symptoms. So that's why we have a blood test called the creatinine, which is a protein that the body makes, and we measure how much it's filtered through your kidney, and then we get that number, the GFR. The GFR is normal from 60 up to 100, 110. Anything below 60 becomes chronic kidney disease stage 1, up until chronic kidney disease stage 5, which becomes dialysis related. So for our patients, especially if you're a diabetic or you have hypertension, you should know what your GFR is. So that's definitely something somebody needs to get used to.
Okay, so that was the second part of the question was, what is a healthy GFR?
Yes, so to go over that again, normal would be below 60 to between 100, 120. The thing with GFR, you may do one lab today, maybe because you are a little dehydrated. There may be some lab variation. So that's why when we see an abnormality, we usually will repeat the blood test to confirm it.
Okay. Amaris asked several questions. Her first question is the function of our kidneys affected as we age?
Yes, definitely. And that's usually the way they calculate the GFR. That will take age into consideration. But yes, the function of the kidney declines with age, but usually not significant enough to get you into that dangerous zone. Dangerous zone is a GFR less than 30. So you can have somebody that's 50 and, they really have no other medical problems. And we realize it is because as they're getting older. But if you see that the decline happens fast, there is usually some kind of underlying disease, not just aging.
Okay. And then we come across this question a lot. What are the common causes of kidney disease and what are the best ways to prevent it?
So there's different types of kidney disease. For example, if we talk about kidney stones, the thing is, knowing if you have a family disposition, that's when diet and hydration becomes important. But the most important one we worry about is chronic kidney disease that eventually leads you to dialysis. And the main risk factors to develop chronic kidney disease are, number one, diabetes. So that's why we're trying to be so diligent in getting a yearly or twice or three times a year blood test on our diabetics to monitor that GFR, again, the term they should know, to make sure that the kidney function stays normal. Second is hypertension. That's a big thing also. Third is medication. A lot of people who take a lot of over-the-counter aspirin, ibuprofen, the non-steroidal anti-inflammatory type medications, this can cause kidney disease also long-term. Also genetics. Unfortunately, the studies really show that just being Native American increases the incidence of kidney disease. So that's why we tend to do Kidney Day, and we try to do a lot more information about kidney disease, because in Native populations, just being Native American is a risk factor to increase to developing kidney disease.
Perfect. Sage asks, what would happen to our bodies without properly functioning kidneys?
So the first thing, that's a really good question. And that's when, again, I say symptoms-wise, you may not notice anything until it gets to less than 30%. Usually the first symptoms that people will see with kidney disease, there is kind of water retention. A lot of people who have water retention, they worry about their kidneys not, but definitely that can be one of the first signs. So you get edema, some water retention in your ankles, in your hands. As the GFR decreases and the kidney function worsens, you will get nausea, headache, eventually vomiting, and the accumulation of toxins. The way I tell people to try to understand what kidneys do, it's almost like an oil filter for your car. If you have an oil filter that's dirty, that's not running well, you will accumulate, for lack of a better word, gunk around your engine. And eventually, when there's enough of it, the same thing with kidneys, when there's enough toxins accumulated, that's when it starts affecting your engine. That's when it starts affecting your body. But you can have a lot of gunk or a lot of toxins up to a GFR of about 30, and the patient has no symptoms. Again, that's why it's important to do the blood test regularly to monitor it, because you don't want to wait until you have symptoms, and that's when you go and check the numbers.
Good point. And then I guess this is probably one of those questions that should have been asked first. What is kidney disease?
Yeah. So again, kidney disease, there's different types. There's acute type kidney disease. So kidney stones, urinary kidney infection. So you can have, it's called pyelonephritis, when you have a urine infection that goes into your kidney and you get kidney pain, kidney infection. This is treated with antibiotics. Kidney stone causes acute pain. So those are usually the acute kidney diseases. Then you have the chronic kidney diseases, which is where your GFR, the function of the kidneys slowly decline, usually do some kind of disease like diabetes or hypertension. Then you have kidney disease that is secondary to another condition. So some people may have an autoimmune disease like lupus, and that affects their kidneys. And then, so that's another form. So, but the easier way to think about it is acute, something that's affecting you right now, versus chronic kidney disease.
Okay, and then the second part of that question is, how is it treated?
And again, there's not one specific treatment for kidney disease. It depends on what you have. For example, if it's the acute type, if it's the stones, you can always, if the stone, you cannot pass it, there's lithotripsy where you can break the stone. If it's the pyelonephritis, infection of the kidney from a urine infection, that's treated with antibiotics. If it's something that's related to an autoimmune disease, you treat the autoimmune disease and the kidneys get better. When it comes to the chronic kidney disease, where you see a decline, a progressive decline in your GFR, in the kidney function, there's no treatment for kidney disease. The treatment is treating the underlying thing that's making your kidneys worse. So if it's your diabetes, if you control your diabetes, usually the kidney disease progression will stop. Now, once it gets to end-stage kidney disease, that's what we call dialysis dependent. So once you get to below 20, the symptoms can be, like I said before, a lot of nausea and vomiting. Sometimes you can have chest pain. You get bad headaches. You get body water retention. Blood pressure becomes more difficult to control. That's what we see at end-stage renal disease. When it gets to that stage, the only treatment is either dialysis or a kidney transplant. So again, the main thing with this, I think the message in kidney disease is get your numbers checked. because that's the only way to know if you have any kind of kidney problems. And once you identify, work not to let it continue, because once it gets to a point, it's either dialysis or transplant.
Wow. It's important. And then now we have Susanna T. asks, what are the steps to maintaining proper kidney functions as we get older?
Very good. So this is really important. Again, the first step is to know where you are. What's your number? Every other, I always say there are specific numbers every patient should become familiar with. You should know what your A1C is. You should know what your blood pressure numbers are. You should know what your GFR number is, especially if you're a patient with diabetes or hypertension. So now the first step is to know where your numbers are. Now, once you know this, what you want to do, the steps you can do to prevent either from getting worse or to prevent having any kidney disease, is maintaining proper hydration, looking at your risk factors. Do you have hypertension, diabetes? Do you have autoimmune disorders? And if you have those, make sure you work with your medical team to control those. Avoiding medication that can be toxic to the kidneys. That's where being careful with anti-inflammatory medications. And there's a whole list of medications that may make kidneys worse. So those are usually the three most important things. Knowing where your numbers are, knowing what risk factors you have, keeping well with hydration, and avoiding what we call nephrotoxins, medications toxic to the kidneys.
Which leads us to the last question, which actually you said this part of the word from Gemini. What is a nephrologist?
So a nephrologist is a doctor who has a specialty in kidney disease. So the way they work is you do 4 years medical school, then you do 4 years of, so you do 4 years undergrad, then 4 years medical school, then you'll do 3 years of general internal medicine. Then the nephrologist will do an extra 2 years of fellowship in kidney disease specialty. But when they finish with that extra 2 years of fellowship, then they become a board certified nephrologist, a doctor that specializes in kidney disease.
So we answered every single question, and you did it very, very well. Thank you very much. This will be put up on the portal and also on Instagram so that everybody can see. And if they have any further questions, would it be okay for them to address them to you?
Definitely. I think this is a great way to get to our patients. I love that they sent questions. It's a very non-threatening way for patients to get more information. So, if you wanted to do a weekly thing like this, I'm okay with it.
That's perfect. Thank you so much.
Ask the doctor.
Ask the doctor is definitely something I'm going to consider doing.
Yes, very good.
But thank you, Dr. E. I appreciate it.
My pleasure.